it's a very different experience. You go to a functional medicine or restorative medicine practitioner and you're telling them, I just don't feel right. I know something is not right.
Yeah.
Right. I know what I felt like when I felt great, and I don't feel that way right now. And I can't put my finger on it. You're not just going to say,
well, yeah, too bad.
Too bad. You're not going to say, well, how old are you? You're just getting older.
Right.
This is what happens when you get older.
Oh, you're in menopause. Yes.
You're going to take a totally different approach, and you're going to respect, and you're going to believe that person knows that there is something not right.
Exactly.
And that there is something off. And then you're going to then jump in and start doing some diagnostics. And that's where I think maybe folks who have trained in functional medicine have a real leg up. All right, welcome back to the Healthy and Whole podcast. I'm here today with our guest, Dr. Beth Bartlett. And Dr. Beth is a functional medicine doctor in functional medicine and restorative medicine. And today she's here to really introduce us to the world of functional medicine, which is really, functional medicine is really a whole new, well, it's not really new, but it's new to a lot of people who don't know what functional medicine is or that functional medicine exists. But it's really giving people a lot of hope and a lot of opportunity to improve their health and to find hope with conditions maybe that they've not been able to get the type of help or traction with in the traditional medicine system. So I won't go too deep into this, but Dr. Beth, could you start with just giving us a little bit of an introduction to who you are and also maybe a quick story about how you got into functional and restorative medicine?
Yeah, great. Thanks for having me. Yeah. So I am traditionally trained in chiropractic and went to National College of Chiropractic in Lombard and owned my own musculoskeletal practice in Lisle, Illinois for probably about 8 years, I think. And during that time, just kind of got some more education, continuing education, and kind of got into bioenergetic medicine and testing. And started figuring out there was kind of more out there. This was probably back 2010-ish, I would say. And I ended up getting my certification in functional medicine from Institute of Functional Medicine in 2019. And that is primarily what I do now. I don't really do any adjusting anymore or any chiropractic work, although I find it very valuable. And just focus on nutrition, functional medicine, restorative medicine. And when we say restorative medicine, it's kind of like saying, we're going to restore you back to the place where you really never should have left in the first place, if that makes sense.
Yep.
So, so just another word for functional, but kind of a little bit of an analogy to that. So,
yeah. So I think that's a great segue into, I think, starting to introduce people to some of the concepts and understanding what is functional medicine and restorative medicine. I like the use of the word restorative because I think it's something that just lands, it's more relatable to people.
Absolutely.
But help us just open up the window to what is functional medicine and restorative medicine sort of in layman's terms so that people can start to understand some of the differences.
Yeah. So I would say it's kind of, if you think about a stream, it's looking upstream versus looking downstream, if that makes sense. Or if you think about fire versus looking at what the fire produces, and that's the smoke, we're looking back at what caused the fire. So looking, otherwise known as kind of the root cause of whatever the issue might be. So somebody's got diabetes, and I'm just taking that as an example.
Yep.
So looking at, kind of, is there more of a digestive issue involved, or, is the pH out of balance? What inflammation? What's going on with inflammation? What hormones? And it's kind of looking at the body as a whole versus kind of, just straight thinking, kind of one way blinders on type of mentality. So
Yeah, I like the analogy you use with the fire and the smoke, right? We have a lot of clients that we work with who do come in with some stage of diabetes, whether it's pre-diabetes or diabetes. We also have a lot of clients who come in. One of the biggest things that we see is autoimmune conditions, like Hashimoto's almost seems to be the most common one. But what I'm kind of hearing is that you're not necessarily just looking at like the smoke being like the symptoms, right?
Correct, yes.
Treating the symptoms or
The
trying
outcome
to,
of X.
yeah, you're not even necessarily trying to manage it. You're trying to find the root cause
the
and put the
reason
fire
behind-
out,
Right, exactly.
if possible.
Yes.
Where possible.
Yes,
You know,
exactly.
sometimes it sounds like it might be management, but a lot of times, if there's the ability to, you just want to put the fire out completely.
Exactly.
I've actually been using this analogy a lot recently with some of our clients in other areas like emotional health and mental health, but I think it actually really applies here to break this analogy down, because with fire, there's different types of fires too, isn't there?
Very true. Yeah.
You have like
Right.
electrical fires,
Exactly.
grease fires, like
Exactly.
wood burning fires and all that, and they all require different approaches.
Right.
Right. So
Right.
I think that's a really interesting
Yeah.
analogy.
Absolutely.
to be able to
Forest fire.
Yeah, exactly. Yeah. Well, I also just love, again, I love the fire analogy too, because what happens with a fire when we don't address the root cause?
Right. It keeps going.
It just keeps growing and it keeps growing, and over time, it just gets more and more out of control.
Yes. Absolutely.
So I think I love, and I also love the analogy you used. You guys will learn I'm a huge fan of analogy and metaphor, so I wanted to take some time on these before we move on.
Sure.
The upstream versus downstream.
Yes.
Right. So
Right.
what I'm kind of hearing there, or to translate, is you're trying to, rather than trying to pull people, out of the river.
Right.
Kicking
Kicking and screaming when they're
Yeah.
way down the river
Yeah, you're looking upstream and saying, how are they getting in the river
in the first place.
in the first place?
Right.
Yeah.
Right.
Very cool.
Yeah. Yeah.
So,
absolutely.
let's start to dive a little bit deeper. Then we've kind of fundamentally talked about concepts of, we're trying to find the root cause. We're
Right.
not trying to treat symptoms or manage. We're actually trying to put the fire out
Right.
if we can. We're trying to maybe start earlier in the timeline of disease progression, which I think we'll talk about more here in a minute. But what are some of the more fundamental ways that functional medicine differs in the way that you look at disease and improving health? And I think about health span versus lifespan. There were a few things that you had brought up when we were preparing for this. Just fundamental ways that you look at this differently.
Yeah, so I try to, when someone comes in, I try to, of course, listen to them, but not ask them what's wrong, but what may not be right, per se. I know that's a little bit of a little bit of a difference in, somebody saying, okay, well, Matt, what brings you in today? So, I might back up and say something like, tell me your story. Let's start from, and I want to hear the whole thing. Start from the very, very beginning.
Yeah.
And because all of it matters. And chances are they're going to tell me or anybody, what their real issue is in that time. So, and I let them talk. So it's better, I find, if they're doing more of the talking than I am in the very beginning, at least. And, it's trying to get to the point of not managing their disease, but managing their wellness.
Yeah.
And if that makes any sense at all. So not really shooting for a particular diagnosis or a bullseye, I might say, but what are the areas outside of that bullseye that we can take care of? So, like you mentioned, thyroid before, hormones, pH, stress. Stress is a huge, huge, huge piece.
Yeah.
And adrenals and all of that. So, just not shooting for the bullseye, but looking for all the other signs kind of around it where we can start to make an impact that lead to, deeper, further outcomes.
Yeah.
So,
I want to unpack some of the things that you mentioned because I think they're really important. And I've actually had great feedback from some of our clients who have come to work with you and other functional medicine providers for the first time, because before that, all they've known is going into a traditional medical practice and working with a doctor who's in a traditional medical practice. And I always want to be careful when we're having these conversations to make sure that everybody knows we're not talking down or downplaying anybody in a traditional medical practice.
Absolutely.
In any way, shape, or form. Right. But the experience in the approach, the functional medicine approach, is very different. And one of the things I hear most from people who have gone and worked with a functional medicine practitioner like yourself is they're often amazed at how much time you spent with them, especially in that initial consult. Oftentimes it's 60, 90 minutes.
90 minutes, yep.
And they're often just sort of amazed at how much they got to talk. But not just that, but they're kind of surprised at how far back you go, all the way back to like infant and childhood, and talking about things like, did you have a lot of antibiotics as a child? And tell me everything from the beginning all the way through.
And I might add to that, just sneaking in something there too. A couple questions I ask are, how was your mother's health when she was pregnant with you? Were you a C-section baby? Were you born naturally? Were you breastfed or bottle fed? So, has a lot to do with how the gut microbiome gets set up and from there. So, sorry, I just wanted to add that in. But and people look at you and think like, why are you asking me that question? But it's important, I think. So
it is. I think that is one of the things that functional medicine has really zeroed in on, is how from the very onset of our life, even from our birth, how certain aspects of that can have long downstream impacts. Right?
Absolutely.
And it kind of like a fire. It starts as that little, just
spark.
The methods through which you were born, not saying that a C-section is bad or anything like that, but it has an impact, right? There's a difference, pros and cons and things like that. And there are things that functional medicine has really been able to clue in on and say, oh, okay, well, we're seeing these sorts of problems and disease progression and symptoms and things later in life, and you've been able to walk it all the way oftentimes back to childhood,
right?
Lifestyle or how they were born, or how the parents and like the familial culture around lifestyle and food and all of these different things. And it's really fascinating. And I love what you said about not just looking at what's wrong, because that is one of the approaches. The more of the traditional approach is, okay, what's wrong with you?
Right.
Okay.
Right. Let's figure that out.
You're hurting. There's an acute issue here. Are we, pain medication management with, a pharmaceutical, is there a procedure that we need to do, things like that.
Exactly.
And it's like, hey, what's wrong? How can we make it less wrong or do something there? And you're more looking at saying, okay, we see what's kind of wrong here, the symptoms, but what's not right that is creating this wrong?
What led up to this?
Yeah. Absolutely.
Right.
And then I also love the analogy you gave with the bullseye, because it's less about, it really is less about what's wrong, and it's about looking at all these other areas of your health and your body systems and your even outside of the body, your lifestyle components and things like that, and understanding how it all is contributing to that issue that's in the center of all of that.
Right.
And I guess to start to bring this particular topic to an end before we move on to the next question here is, I think this is where people are finding so much hope in functional and restorative medicine, because what I'm seeing happen is that folks who are going to functional and restorative medical practitioners are achieving outcomes that they've never been able to achieve outside of functional medicine.
Correct.
And I think it's because you're approaching it in a totally different way. And that I think that brings a lot of hope.
Yeah. Just
people.
asking, and sometimes it comes down to just asking different questions. And, like we were talking about lifestyle, family, what was your home life like when you were a kid growing up? Where did you grow up? Was it in the country? Would you live out, on a farm, or was it more urban in the city? Because, those things make a difference in terms of, when you're trying to look at
Yeah.
mold and mycotoxins and what somebody might have been exposed to at a young age and that type of thing. So
were you out playing in the dirt on the farm, or
Right.
was your mother a clean freak who bathed
neat
you
freak.
3 times a day and vacuumed the carpet 4 times a day and you know
Yes.
and all of that?
It's better to have been playing in the dirt, actually.
It is. It
than-
is. Yeah.
So, yeah.
Yeah. I joke sometimes about when Lachlan was little, and even now with Corbin, like sometimes he'll drop something on the ground and then pick it up and put it in his mouth. And some people are like, "Oh, my mom will just grab it." And that past generation, oh no, we can't
Right.
do that. We have to clean it off. I said, no, just leave him be. This
Yeah,
is good
just
for him.
let it go. Let it go. Yeah,
Just probably good for his microbiome,
absolutely.
for his gut. But so we've kind of dug deeper into some of the different approaches and the way we're looking at disease and health and optimizing. Can you talk a little bit about just the overall power and importance of timing when it comes to disease progression, and how maybe break down how functional medicine, restorative medicine is looking at the phases of disease and where that work is happening?
So one of my mentors really kind of helped me understand this concept is, you're born healthy, and then you die. And so there's kind of 3 areas in that are defined as the chi, water, and blood phases. And so the first third, the chi phase, is kind of when you're not feeling quite right, but you're not, not sure exactly what's going on, but you're just not feeling the best. And chi kind of stands for, is another word for energy. If you're talking, traditional Chinese medicine. Second phase is the water phase, and that's when you really start to develop symptoms, and things kind of become more apparent, if you will. The blood phase is kind of when you cross that imaginary line into that 2/3. Blood phase is when things start to show up on tests, scans, X-rays, things like that. And that's where what I'll say traditional medicine really shines is they're like, oh, now you've got it. We can see it on paper or whatever. And so let's address it. So we try to do more of our work really in the first 2/3 in that chi and that water phase of, I'm not feeling my optimally, or I don't have as much vitality as I once did.
Yeah.
And so let's unpack that, like you said, and figure out, kind of what's going on, dig a little bit deeper as to why you're not feeling this way before, you get to that blood phase where things start to show up, and then we have to work a little harder to get you pulled back. So
yeah. I love what you said when before the episode, we were talking about this. You said you have to be more than 2/3 sick oftentimes before you get some kind of help, right? And again, I'm not saying this to poo-poo on traditional medicine.
Correct.
Like you said, like medicine 2.0, traditional medicine, like we're here because of that. We wouldn't be here, without some of
Absolutely.
Of that. And like it is crucial, but
It's necessary.
It's necessary. We're looking beyond it. And one of the very frequent stories that I hear from clients who come in and people who we're actively working with, and they are dealing with levels of dysfunction in maybe the first stage, they're just not quite feeling right. I definitely hear this a lot with folks who are dealing with thyroid issues. And then even in the water phase, when things start to become a little bit more apparent, there are stories, and there are a lot of instances where folks will go to their traditional medical practitioner, and again, not because they're bad, have bad intentions or,
Right.
or anything like that. It's just that the way that framework is sort of set up is the approach is so different from the functional medicine approach that they're kind of like, well, we don't have, there's not even enough smoke here for me to,
Do
I
anything, or-
don't know where to look. Like come back when this is more of an issue is honestly the response a lot of them get, or, they might even there might even be something that just slightly shows, elevated even on a blood test, and they'll say, well, it's not really high enough for us to worry about yet. We'll worry about this, in a couple of years.
Exactly.
And it's like, well, what I love about this approach is, it's a very different experience. You go to a functional medicine or restorative medicine practitioner, and you're telling them, I just don't feel right. I know something is not right.
Yeah.
Right. I know what I felt like when I felt great, and I don't feel that way right now.
Right.
And I can't put my finger on it. You're not just going to say,
Well, yeah, too bad.
too bad. You're not going to say, well, how old are you? You're just getting older.
Right.
This is
Right.
what happens
Blame
when
it
you
on
get
age.
older.
Oh, you're in menopause. Yes.
You're going to
Exactly.
take a totally different approach, and you're going to respect, and you're going to believe that person knows that there is something not right,
Exactly.
and that there is something off, and then you're going to then jump in and start doing some diagnostics.
Right.
And that's where I think maybe folks who have trained in functional medicine have a real leg up, over the training diagnostically that you get when you initially go through traditional medical training. Is that you are equipped with the ability to know where to look,
Right.
and to do a different. So talk to me a little bit about when it comes to functional medicine. What does it look like? How is it different from a diagnostic standpoint when you're like, okay, this person is saying something is not right? What does it look like diagnostically? What's that look like in functional medicine? How does it differ?
So the one thing that I'll have most people come in is when I initially see them is if they've had any recent blood work done, I'll say, bring a copy of the blood work. Let's just kind of some baseline blood work. Let's see what that looks like. And so as to, what you were saying before, the way things differ is there's a difference between normal lab values and optimal lab values. So we want ideally, obviously, people to be in the optimal range. And what that is, just kind of putting tighter parameters on those ranges. So, going back to the blood phase of disease is we wanna catch you before you cross over that line. So I'm gonna say something. If somebody's got a glucose that's 100 or 101 or 102. I know that I want to be ideally, we want to be 90, under 90-ish. And so if somebody's like hovering 100, 101, I'll say, we're teetering on a line of, higher glucose type issues here, and we want to nip this right away. And so oftentimes I'll start, asking questions about blood sugar regulation and talk about, are you, when you have a carb, are you pairing a protein with it or a healthy fat with it, and eating that first to help with the blood sugar spike there at the very beginning. But also I kind of lost my train of thought there about the glucose, but
That's okay.
Just making sure of not saying, well, we'll check it in 6 months or we'll check this in a year. No, we're gonna address it right now.
Yeah.
And kind of just go from there. But that's a big thing, and oftentimes I'll say. Now I remember what I was going to say is I'll look at insulin levels when we're talking about blood sugar, I want to see the glucose, the hemoglobin A1C, a little bit about what the triglycerides are doing, and then most folks don't have insulin levels, fasting insulin levels drawn, but that gives me kind of a tip off of
Yep.
even before the glucose starts to rise, that insulin level will start to rise and tell me that
Yeah.
pancreas is working a little bit too hard. And so that's something we can look at prior to even, looking at the glucose and see that we're headed in a not so good direction. And again, nip that right away. So, but yeah, looking at you talked about thyroid, Hashimoto's before.
Yep. I was going to bring that up.
That's another piece to the whole thing. Is most traditional medicine only looks at TSH, thyroid stimulating hormone, and maybe a T4, but we want to look at T3, free T3. T3 is the most active form of the hormone.
Yep.
So really want those levels to be optimal, and looking at the antibody levels of the thyroid as well in terms of autoimmune function and autoimmune disease. And so because it makes a difference, in how what our approach is, but also, in looking at nutrition and, what's best for you. Are you having autoimmune tendencies, or are you not so much? And, we can tailor the nutrition piece to that, to that end. So,
this is, I think, just using the Hashimoto's thyroiditis example is a really great illustration in general to use to help people understand the power and the impact of functional and restorative medicine. Because you're right, when you go to a traditional, doctor, they're going to check one or two blood values. And what you mentioned before is there's sort of traditional reference ranges that they look for those values to fall in. And then there's your optimal reference ranges. And, like a functional medicine practitioner might want to very tightly see the TSH, between like 1 and 2. And then, if it's above or below that, you're starting to look closer. You're not freaking out, but you're starting to look closer. Whereas a traditional medical practitioner will let it get all the way up to 4.
Right.
Before they even start to think anything about it. But even deeper than that, what I love about the functional medicine approach is that, you guys are running such more comprehensive labs for something like this. Free T3, free T4, you're looking at the antibodies. You're looking at reverse T3.
T3 uptake.
You're probably sometimes running nutritional labs to say, because there's so many different things that could be causing a thyroid issue. It's like, okay, do I have the nutritional components to make and to convert thyroid hormone? Do I have like a stress component that's driving up, reverse T3 or something like that? Do I have autoimmune issues where I have food sensitivities that are driving up my antibodies? Do I have a utilization issue where my cells just aren't absorbing and utilizing the hormone?
Exactly.
And every single one of these could be a different cause or root cause, different kind of fire.
Right.
When it comes to it.
That we're going to address differently.
Exactly.
Yeah.
And it's like, to me, this is where functional medicine does it right, because otherwise we're just ignoring the fire completely until it gets big enough, or we're just trying to throw water on a grease fire,
right?
Or something like that.
Yeah.
And we're not helping.
Exactly.
Right. Whereas with functional medicine, this is just why I wanted to like break that out more.
Open that up a little bit.
Now we can figure out, okay, are you just not converting T4 into T3?
Right.
Which
is one issue.
Approach to that. Are your antibodies higher? Now we can look at triggers and food sensitivities and environmental triggers and figure out why.
Right. Exactly.
Is that the case? If your reverse T is super high,
Yep. They're competing for reverse T3 can kind of compete for binding sites on the cell. So it can kind of crowd that T3 out of there, and energy fatigue. Yep. That's a lot of what I see. I'm seeing a lot of thyroid actually combined with anemia right now, which is a big piece. So hemoglobin levels in your CBC, I don't like to see them anything below about 13.5. And I'm seeing people 12.9, 12.5, and their traditional provider just kind of overlooks that and doesn't say anything. And I asked a question and I said, well, does anybody ever mention this to you? And they're like, well, no. And, so that's a big piece to healing, is anemia, and looking at, where that blood comes from, looking at the liver, spleen, that type of thing. So,
So hopefully folks are starting to see just there's so much more of a comprehensive approach that we can take when it comes to understanding
right.
the symptoms or what's going, what's not right, to be able to figure out how to right the ship. I think this is a great segue into talking kind of a little bit more about, because you brought up a few things in that last question about lifestyle, food, your nutrition, and things like that. So can you talk a little bit about the difference between, like we talked a little bit about the pharmaceutical first kind of approach with traditional medicine, and some of the different ways that functional medicine would approach some of these things differently with, food, lifestyle, things like that.
So we try to take a kind of what I will call a food forward or a food first approach. Ideally getting as many nutrients from food as we can, but we're also going to use holistic remedies, homeopathy, nutraceuticals, supplements, things like that to get you where you need to be, and ideally food for food to take over after that. Once we kind of reach that point. But yes, looking at what you put in your body. I think I know that I didn't, before I got into this field, I really didn't even think about it. Didn't even cross my mind that what I ate affected how I feel. But it is so apparent and so real. I guess as I get older, you get wiser, right?
Yep.
And so I just try to look at what I'm putting in my body and saying, okay, is this gonna help me feel better, or is it not? One of my patients said the other day, she said, am I letting my food control me, or am I controlling my food? In terms of learning to develop a better relationship with, changing your relationship with food, basically, and using it as, using it as nutrition, versus just something to do, something, social. I know that's a lot of, kind of a big thing right now is anytime everybody gets together, it's around a table, food, and we're gathering. That's great. But, let's really think about what we're putting on our tables. So,
Absolutely. So one of the biggest sayings I hear in the functional medicine world is food is medicine, right? And we have definitely seen that come, out in real ways in our program with our clients, especially I think about our diabetic clients, right? I think food can be medicine in two really key ways. One, like you said, getting the nutrients that your body needs to be optimal. I just went and ran a bunch of blood tests on myself because I had some suspicions that there were some things that were going to be deficient.
Right.
And I identified that I was very low, or lower than I needed to be and wanted to be on things like omega-3 fatty acids. My vitamin D was low. And I actually was able to identify some other things that I can keep in mind as I go. But tell me if I'm crazy, but I've been supplementing about 3,000 milligrams of like good quality fish oil for going on about 3 weeks now.
Yeah.
And I feel like I have noticed a massive difference.
Yeah.
I prior had been, there were two things that I was noticing. I was having trouble focusing cognitively. And I was a little bit of a mental funk,
kind of a phase.
Yes. And also I had these nagging like aches and pains in my shoulder, and even like sometimes in my wrist and different things like that. And since I have really been bringing those levels back up with supplementing with the fish oil, I'm sensitive to the fact that it could be placebo,
Right.
but I don't notice any. I feel like I am so much more sharp cognitively. I am more positive mentally and emotionally, and I don't notice any of these pains or aches anymore.
Right. Yeah. It's pretty amazing just the power of that. And I will say, I'll second your thought on the brain function. I mean, I would say first and foremost, brain function, fish oil and brain function go hand in hand. The other thing, fish oil is actually one of my favorite things to use for high cholesterol. And because, believe it or not, fish oil will actually help decrease cholesterol. And our cells are also made of a fatty phospholipid layer. And so as we do get older, we need to keep replenishing that phospholipid layer, because we don't want our cells to become leaky, so to speak. And we want them to be shored up and very strong. And so, those are just some examples of what I like about fish oil. So
yeah, absolutely. Sure. And to I guess tie a bow on that thought is that I did the diagnostics. I recognized that I was, and that's not a diagnostic that like a normal traditional medical practitioner would ever run.
Right.
But I did that diagnostic, realized that I was deficient, started supplementing those things. But when it comes to food as medicine, the reason I was deficient is because I don't eat the type that my tastes when it comes to my preferences for food. I don't love to eat fatty fish like salmon and mackerel and things like that.
Right.
I don't get very much of that in my diet. And the reality there is that I have two choices. I can choose to bring more of those things into my diet, and I probably will. But sometimes people are just not open to that, and that's where supplementation, nutraceuticals, and things like that can come in and help to save the day with that.
Absolutely, yeah.
And so getting, correcting deficiencies, making sure our body has what it needs to be optimal is one way, but then the other way that I see food really being medicine is in subtractive ways. Our diabetic clients who have come in, just in us teaching them how and bridging the gap between what they know they need to do lifestyle wise to reduce their carbohydrate intake and bridging the gap and helping them to actually implement it and do it in a way that is sustainable for them is huge, because what is oftentimes driving it is they're just over consuming, they're exceeding their body's capacity to manage carbohydrate. And we just have to help them learn what is the capacity that their body can tolerate for normal blood sugar regulation.
Yes.
And teach them and help them make the lifestyle change with their diet to do that. So food can be medicine additively and subtractively.
Yeah, absolutely.
In big ways.
To kind of add on to that, timing of the whole thing. I know intermittent fasting is a big, topic these days. And like I had mentioned before about pairing things together, when you're having a carbohydrate, let's say you're having some gluten-free crackers or some fruit or something like that, or a sweet potato, you always want to pair that with a healthy fat, avocado, or a protein, and eat that healthy fat or avocado or healthy fat or protein first, so that it prevents that blood sugar spike in the end. So, that's just a little tidbit.
Yeah.
Adding on to that. And then in terms of if you're eating a plate of food and you're sitting down to dinner and you really want to eat, let's say you divide your plate into thirds, you really want to eat your fiber and your veggies first, then your protein, and then your carb last. So just kind of thinking if you're eating a, kind of a full meal versus a snack, just something to think about as you go about your meal.
Really helps to mitigate the sharpness of the blood sugar spike.
Exactly.
For sure.
Yeah.
And then the other piece of this that I wanted to bring in is not just the food, but the focus on lifestyle. And to build on the diabetes example, or the blood sugar regulation example we were just giving here. One of the things that we teach and we talk about a lot, especially with our folks who are coming in with some stage of diabetes, is that walking is insulin. Right. So, if you're going to have a meal, one of the best things that you can do if you have the ability to do it is to immediately go walking right after that meal. One of our clients, who is a dear friend of mine, this is one of the ways that we helped him to completely, reverse his A1C, and it ended up being that he was actually a type 1 diabetic. He was kind of either misdiagnosed earlier on in life, or it had progressed to the point where he was a functional, his pancreas was just not, producing. But we thought he was a type 2 the entire time, got his A1C all the way down to about 5.1. And he thought he was ready to come completely off of insulin. And he'd been on insulin for many years of his life.
Wow.
And we just realized, oh, dang it, we can't.
Yeah.
We can't take you completely off of insulin. But now, utilizing his lifestyle, doing walking and timing walking with his meals and timing his meals right, and doing like what you're talking about, and making sure that he's not ever just eating carbohydrates, things like that.
Right.
And consuming the right amount of carbohydrate in a day, he's able to really live his life on the minimal amount of insulin that he would ever possibly need as a type 1.
That's fantastic. Yeah. That's awesome.
So all that just to say lifestyle
matters. And I'll add to the food piece. We talk about sleep. We talk about exercise. We talk about, I ask, patients about their bowel habits, because as we all know, the GI system, the digestive system is a huge piece of the whole puzzle. So, what their home life is like, what they do for a living, their stress levels, how they manage that stress, what they do to help with those things. So, because we all know, if you're not getting enough sleep, then forget about it. Because your body needs energy to heal.
Yeah.
So if you don't have that energy, then if you're not sleeping, we got to get you sleeping good first, and then we can start to work on the other things. So,
absolutely. Yeah. So you're really bringing in so many different aspects of lifestyle as medicine: what we're eating, how we're sleeping, our stress, what's causing stress, how much do we have in the way of stress, how are we interacting with stress and with the world. How are we pooping and eliminating waste from our bodies?
It really is.
How are we exercising? All of and I know that's just the short list, but all of these things are really like the inputs that create chronic health.
Yeah, absolutely.
Versus chronic illness. And I think that's what I love about the functional medicine, philosophy, is that when we approach things with lifestyle first, we often, and if we start in these earlier stages that you were talking about with the chi and the water phase, we often don't ever have to get to the place where we need pharmaceuticals and we need to do real deeper interventions. And we start to see, when it comes to health span, how long, not just how long am I going to be alive? When you were talking about, you said we're born and eventually we die. And in between, there's a whole lot of stuff that happens. Right. How long am I going to feel amazing?
Right.
How long am I going to be able to be active and functional and move and do the things that I want to be able to do with the energy that I want to be able to have?
And ideally, you want to have that, obviously, as long as you can. Right?
As long as you can.
Right.
Yeah.
So equipping ourselves with all those tools and education and knowledge as best we can is, obviously ideal.
Yeah.
So. Yeah.
And I think as we start to kind of round this out, we started this whole podcast episode with a little bit of talk around analogy and metaphor. So I want to leave everybody as well with a little bit of an analogy or metaphor that they can take with them to start thinking differently, maybe about their body, their health, in a way that will start to influence and change their day-to-day decisions in their day-to-day life. So, could you provide us with some kind of a helpful metaphor or analogy for our viewers?
Yes, absolutely. And it's a house analogy, actually. And thinking about functional medicine and how to apply that to a house analogy is being a home inspector. Talked about being a home inspector for a day or this visit or what have you. But just at the very foundation, as we were talking before, it matters where you build your house and the soil that you are building upon. So as we were mentioning, the how you were, where you were born, family history, the genetic predisposition, your childhood upbringing, things like that.
Yeah.
That's the soil. Then the foundation is our digestive system. And so really building a good foundation, I always talk about that as it's GI system is about 70% of our immune system. And so I think that's if you don't know where to start, that's always a good place to start. And so really building a good foundation, because as we all know, anything not built on a solid foundation is going to fall down. So, and just kind of going from there, but just in that very very baseline foundational aspect of building a house. You want to build, on that solid foundation, moving to the walls of, the supportive structures. Like this gets into the lifestyle piece about mental and emotional support, emotional boundaries, self-care, things like that. Then we get into the energy and looking at all the outlets in your house and in your mitochondria and how that's functioning, your neurotransmitters, your sleep quality. The thermostat is a very important gauge in terms of hormone regulation. And so looking at, is that thermostat turned up or is it turned down? Is it just right? Often looking at cortisol, inflammatory signals, hormone signaling there. Oxidative stress, you probably hear a lot about. That's kind of our chimney, a little bit of a chimney analogy. We want to make sure things are getting out of the body in terms of elimination. So liver, kidney, bowels are open and draining and functioning. Looking at the roof as almost our immune system, our skin integrity, want a good roof over our heads as well, and to protect us from the external toxins that are going to come in. So heavy metals, pesticides, herbicides, EMF, Wi-Fi, things like that. So, and all of these can have triggers. So we can have, an illness or a trauma or, stress thrown in any one of these areas, and we'll have to kind of back up and say, okay, what's kind of, if you think of a bucket, what's causing holes in our bucket here? And so we gotta patch up those holes.
Yeah.
And then we can kind of move on. So it's not just, smooth sailing from, foundation, walls, check. All these things are good. So it takes, it's wellness is for a lifetime, really. Right. And so, we just kind of roll with the punches, but just kind of thinking about things in that way is often helpful for folks. So.
Absolutely. I love the analogy of the house because, as a homeowner, I know that it's never ending.
Right. There's always something.
There's always something to look at or something to address. And, it kind of is like, you plug one hole or you patch one hole in the roof and, something else will crop up, right? The human body is it requires some maintenance,
yeah, absolutely.
Just like a house does.
Just like a house. Yep.
So I love that analogy, and it gives people some good ways to think about, a lot of times they probably just don't even think about all those different aspects,
Right.
Some of the big ones that I heard were my digestion, my energy, my my elimination.
Yeah.
The
big one.
Just like a lot of these different things kind of also backtrack to where you talked about before, to like even just that chi or that water phase of something doesn't feel right. I'm feeling like I'm not my energetic self, right? I'm dealing with some digestive issues.
Yeah, I'm bloated, or
I'm bloated.
Yeah.
Digestive discomfort, irritable bowel, different things like that. Or I'm just not going to the bathroom.
Right.
That's one thing I have noticed many times with clients who will start working with, who have coming in with a level of dysfunction. They're like, I never go to the bathroom.
Ding, ding, ding.
And
yeah,
yeah, like
that's our first.
Yeah, the chimney is blocked.
Right,
right. And I just use that analogy. What happens when you've got a fire in the fireplace and the chimney is blocked? Where does that smoke go?
It
right?
goes back in your house.
It's causing some problems,
Yeah.
right? So I just love that entire analogy. As we start to wrap up here, let's just suppose that there are probably a lot of people in our who are at some point in time going to watch this episode who are saying, you know what, I am suspicious that I've got some problems right now with my house. Maybe they're in the chi phase and they're just like, I just don't feel quite right. Maybe they're in the water phase and they're very aware of some symptoms that they're dealing with. But they just know that there's some opportunity and they don't want to go the traditional route. They've maybe tried that and they're not getting the help that they feel like they really want and need. How would they enter into the realm of functional and restorative medicine, either with you or where could they go to A, connect with you?
Yes.
And or B, find a practitioner, even around them if they're geographically doesn't seem to matter anymore.
Right, exactly.
Since we've all been through COVID, we can do anything remotely.
Right.
But how can someone jump into the world of functional medicine, get the help they need?
Yeah, awesome. Well, my office is in Lebanon, and
Lebanon, Indiana.
Indiana.
Yeah.
And so my website is www.Dr. Beth Bartlett, all one word, .com, and you can schedule an appointment either online or in person from a link on that website, and it takes you right through that. I have an online portal and very easy to move through. And I'm also on Facebook, Dr. Beth Bartlett Holistic Health. You can search that and follow me there or like the page. And but also if you're listening from another part of the country and you really want to see somebody that's more local, I would recommend ifm.org, Institute for Functional Medicine.org. And I believe there's a find a practitioner link on there, and you can plug in your zip code or city or whatnot, and some certified practitioners will pop up, and you can contact them, and so that's a good way to connect there. So.
Awesome.
Yeah.
And highly recommend if there's anybody out there who is suspicious of this and feeling like they want to take a next step to get a deeper level of diagnostic and to dive a little bit deeper into a different approach, one that is more lifestyle, food first, focus, then absolutely reach out to Dr. Beth. She's amazing.
Awesome.
That's why she's here. And or go to the IFM website and just, what do you have to lose?
Right.
The reality is you have
Nothing.
a lot to lose by not.
Right. You have everything to gain. Yes.
Stepping into that, and you have everything to gain. So thank you so much for being here, Dr. Beth. This has been awesome. I would really look forward to future episodes here with you. We can dive in deeper conversation around some of the different parts of the house and some of the different facets of things, specific conditions that are very common. I really look forward to some of those conversations. Thank you so much for coming, and we'll see you next time.
Awesome. Thanks, Matt. Appreciate it.
Thank you.